Welcome to Sacred Heart Virtual Maternity Tour for Sacred Heart RiverBend. My name is Karen. I'm one of the nurses from Labor and Delivery in the Mother-Baby Unit, as well as a lactation consultant. I have worked here for 34 years, all in the maternity department, and I will be taking you on your tour today. I'd like to talk first about parking. You can park underneath the hospital, and there is one elevator that will bring you just to the first floor, so you'll be able to check in right at the main entrance, main lobby, when you come in to have your baby. During the day, it might be hard to find parking underneath, so we have a designated area just about 10 feet north of the main entrance outside. You'll be able to park in a parking area. There are 3 emergency spots for mothers-to-be. Park there, go ahead and bring mom in, and you can go upstairs with her, get her checked in. When you know that mom is staying and you feel comfortable leaving mom for a few minutes, feel free then to come back down and move your car. We don't want you to miss the birth of your baby, so be sure you feel comfortable leaving her for a few minutes. And then I think the easiest place to find parking is at the north end of the hospital in the surgery parking lot. You will then need to walk back to the middle of the hospital, which is where the main lobby is. So the admission process is very simple. You will be checking in at the registration desk, which is in the main lobby of the hospital. It's in front of the big fireplace. You will just need to give them a couple of pieces of information, such as when you're due, who your doctor or midwife is, and your name. And then someone from admitting will take you upstairs to the labor and delivery area. So just to give you a little bit of an orientation, we're here in the main lobby of the hospital on the first floor. If you look up behind me on the second floor is where if you go through where it says hospital elevators, that's where the coffee shop and the cafeteria is. So remember, that's in the middle on the second floor. We also have our public use elevators that are on both ends of this middle part, and we will be taking one of those elevators up to the 5th floor. On the 5th floor in the waiting area is all in the middle section of the 5th floor, and that's where families and friends wait while you have your baby, so we'll be going up there next. On the north side of the 5th floor is labor and delivery and the neonatal intensive care unit. Then on the south end of the 5th floor, after the baby's born, you will be moved to a mother-baby room. So I'm going to show you both sides so you'll be able to see both areas that you'll be in when you come in to have your baby. So here we are on the 5th floor in the waiting area between the north and south ends. And we have a security guard that is stationed here from 5:30 a.m. until 8:30 at night. So people who are coming to visit you when you're in labor or after you've had the baby can check in with a security guard. You need to make sure they know what first and last name mom is registered under, and then they will get a little badge that'll have your room number on it and the day of the week. So that's the only way that they'll have access behind the closed doors for either mom, baby, or labor and delivery. When mom comes up here with her main support person, she will go through those double doors and be checked into the labor and delivery area. After it's determined that she's going to stay and have her baby, she can have up to 4 support people in the room with her. We recommend that everyone else feel free to wait out here in this comfortable waiting area. We have our public use restrooms, some public drinking fountains. We also have 2 flat screen TVs, lots of comfortable chairs, and extra plug-ins for your cell phones or laptops. The security guard also will have information about where to go and get food or coffee here in the hospital, and also about cafes that are close by for you to visit as well. We try to make this as comfortable as we can, and it's available 24/7. So now we are going to go to labor and delivery. So this is a labor and delivery room. This is where the babies are born. When you first get in here, the lady from admitting will finish up your admission process in the room. So she will log on to the computer and take about 2 to 3 minutes to verify your registration information. And she will also take a photocopy of your picture ID, like a driver's license, and your insurance information. So after that, your nurse will come in, we'll introduce ourselves and give you one of our really cute designer gowns to change into. And you can bring your own if you prefer, but we'll spend about 20 minutes doing an initial assessment of where you're at in labor. So in order to do that, we'll ask you if we can put you on an external fetal monitor for about 20 minutes. And during that time, we'll monitor here in the room. We will monitor your baby's heart rate and your contractions, and it'll also read out at the nurse's station. So during that time, we will ask you some questions about your medical history and your pregnancy, but our main focus will be, what are your plans for labor and birth? What's important to you, and how can we best help accommodate your requests? So we'll just try to get everybody on the same page, and then we'll check your cervix, see how far you're dilated, and then you're going to have a pretty good idea of where you're at in labor, and you'll be able to call family support team, whoever you're planning to have with you here for the birth. So after that 20 minutes, we generally will take you off the monitor and have you get up and walk around, move around. We know labors are easier to cope with and generally go faster if you're able to be upright and change your position frequently. So I wanted to talk to you just briefly about some options that you have for labor. The bed does a lot of different things. We have a squatting bar that fits over the bed, and you can hang on to the top of the bar and be in a squatting position. You can use that for labor or for pushing. We can take off the squatting bar. We have a lumbar support for your lower back. You can sit the head of the bed all the way up. The bottom third is actually a separate mattress that we lower for the delivery of the baby's shoulders, or we can take the mattress off. Underneath there are footrests and stirrups, so we can use either of those if you would like. And we also have handles to hang on to for pushing. Other options you have here in the room is a rocking chair. Rocking sometimes is a great way to get into a rhythm with your breathing. We also have a birth ball. They're just big physical therapy balls, but you can use them 100 different ways in labor. So use your nurse as a resource. In the moment, we can make some suggestions about positions for comfort. We also have a straight back chair that you can use in a variety of ways, even straddling the chair or using pillows to help with different labor positions. So here in the bathroom, we have a few options for labor that are comfort measures. In the tub is jets, so you can sit in the tub. We also have a shower where we can take the nozzle off the wall and direct the flow of water, let's say on your lower back if you're having back labor. And we never run out of hot water, so you can just use it all day or all night long. Dad or support person can sit behind mom and help hold the water on her back if that sounds good to her. I've had a lot of women spend their whole labor in the shower, and it's comfortable to them. So remember, don't rule that out as an option to try for labor. We have plenty of towels and washcloths available, as well as extra gowns if you need them. So if you are deciding about medication during labor, I wanted to tell you some options. We do have some medication that can be given through the IV, and it takes the edge off of the contractions. And we try not to give it too late in labor so that the baby does not have the effects of the medication when the baby is born. We also have an epidural option for you. We have 24-hour-a-day anesthesiology here in the hospital, as well as 24-hour-a-day obstetrician here. So they are available whenever you decide you would like to have your epidural. So once you decide on that, they will come to your room. If you do not already have an IV started, you will need an IV. And Once the anesthesiologist comes in and asks some questions, it'll take about a half an hour before you're comfortable. And you will be in bed, won't be able to get up and move around, but we'll continue to change and move you side to side so you're not staying in the same position for a long time. You will have a little button that you'll be able to push to control the level of the anesthesia. And we wait until after the baby and the placenta is delivered before we turn the epidural off, and it takes about 45 minutes to an hour to wear off. So you will be able to get up and empty your bladder and take a shower after the delivery. When the baby's ready to be born, your nurse will call for another nurse to come in. She'll stay in the background of the room, do the charting on the computer, so your nurse can be right here at the bedside. Your doctor or midwife will be at the foot of the bed, and your support team will be able to be on the other side. Typically when the baby's born, they'll bring the baby just right up onto your tummy and we'll dry the baby off. They come out, they're all wet. They don't have any clothes on. It's about 70 degrees in here, so they can drop their heat quickly. One of the best ways to keep their temp stable is to keep them skin to skin with mom after the delivery. So that's what we plan to do for the first hour after they're born. We also know that babies learn to nurse better if they learn in that first hour. Their sense of smell is the strongest it'll ever be in those first few hours of life. And that helps them to orient themselves and to find their new source of nutrition after they've been born. When they come out, they look pretty dark, purple, and then when they take a couple big, deep breaths, their lungs expand for the first time, and that creates a negative pressure that keeps their lungs open, and then that seals off a little hole between the right and left side of the baby's heart. So when you see your baby turn that beautiful pink color, you will know that all of that is working just fine. And we can watch for that to occur while the baby is still on your chest. As you hold your baby, we will be checking their temperature, their respirations, their heart rate, observing their color, but we can do all of those things while the baby stays with you. We will involve dad or the main support person in that whole first hour of bonding with your baby. So that's the reason we also ask that you don't have a lot of extra people in for the first hour after delivery. The babies are very alert and awake and oriented to your voices because they've been hearing your voices for the last 3 to 4 months. So if you talk to your baby and cuddle your baby and touch your baby, they will respond to you in that first hour and try to make eye contact with you as well. So we just try to keep you together as a new family unit and not separate baby from mom if at all possible. The skin to skin, there are so many reasons why that's important for babies. So if you want to know more, you can look it up on several websites that we have available, and you'll be able to see that on our website as well. When the baby is delivered, they will wait for the placenta or the afterbirth to be delivered, and that usually takes 5 to 10 minutes. And then if you had an epidural, we'll turn off the epidural. If dad or main support person would like to clamp and cut the cord, we'll be happy to allow you to do that. And we'll just keep the baby then with mom. For mom in that first hour, you're going to be pretty thirsty and hungry after the baby's born. So we keep hot and cold food for you back here, and we will bring you a big pitcher of ice water, whatever else sounds good to you. And if you need ibuprofen or something stronger, you deserve it after having a baby. So we will just love to pamper you a little bit. Our job is to mother the mother so she can mother her baby. So just let us take care of you for a while in that way. And then when you're ready, we'll help you get up and you can empty your bladder and take a shower and be ready to move then to the other side of the 5th floor to the mother-baby unit. For the baby in the second hour, when you're ready, we'll bring in a scale here into the room that will weigh and measure the baby on. We'll do their footprints and their bath. We will also put an ID band on the baby that matches mom and her main support person. We will put a halo button around the baby's calf and it's covered up with a little white sock. And that's our security system. So all of that will take place back here, as well as we'll give the baby 2 medications whenever you prefer that to happen. Vitamin K shot in their thigh that helps with blood clotting, and erythromycin ointment in their eyes. So we will do those back here. We will also offer you the opportunity to have the hepatitis B vaccine. We know that it can help quite a bit more if it's given within the first 12 hours after the baby's delivered. So that will be an option that will be available to you as well. When you're ready to move, we'll bring in the wheelchair and give you your sweet little baby in your arms, and we'll load up all your things on a cart, and we'll go down a back hallway so you won't go out where the security guard and all the visitors are waiting, and we'll take you to the mother-baby unit. So typically you're back here about 2 hours after the birth of your baby. So I wanted to just talk a little bit about cesarean birth. Whether you have a cesarean birth or a vaginal delivery, there are a lot of things that remain the same, but there are a few differences, so I wanted to highlight those differences. If you have a planned cesarean birth, you will be coming into a room that looks just like our other labor and delivery rooms, but it'll be set up with a stretcher instead of a bed. You'll usually come in a couple hours before the delivery, and your support person will be able to be here with you, and they will get you prepared. They'll draw labs, you start an IV, the anesthesiologist and your obstetrician will come in to see you, and then when you're ready, they will usually have you go either on the stretcher or you can walk into the cesarean rooms, which are just across the hallway from us. And then your main support person will be able to get dressed, and they will wait in a little alcove area just outside the cesarean birth room. Once your anesthetic is working, and typically you'll usually get a spinal block. If you're in labor and you've had an epidural, they will bolus the epidural block. And then your main support person will be able to come in and sit right by the head of your bed. Once they start the surgery, it takes about 3 minutes to get the baby out. So be prepared when they let you know that they're starting. You will have your baby very soon in the world. So when the baby's born, typically they'll bring the baby up over the drape, and they typically start crying right away. And then they will take the baby across within the mom's line of sight to a little area where they'll dry the baby off, and the support person can go with the baby. Once the baby's dried off and the baby's doing well, they'll listen to their heart and lungs. If you would like, they'll bring the baby back over to you, and you can have your baby skin to skin with you throughout the rest of the surgery. It takes about 30 minutes for them to finish up the operation, and then all 3 of you will come back to the same room that you were in before. If you were a planned cesarean birth, if you were in labor, then you will come to a room that looks like this. So then you would change rooms. You'll be here about 2 hours. The first hour, we're just focusing on helping the baby breastfeed if you're planning on breastfeeding, and making sure your anesthetic is wearing off. You can just have that main support person with you for the first hour. The second hour, if mom is feeling up to it, she can have up to 2 visitors at a time, up to 4. And then we will delay the bath for the baby until you are moved to the mother-baby unit. So at the end of the 2 hours, we'll move you out on a stretcher. You'll have your baby in your arms, and we will load up all your things on a cart, and we'll take you down the hallway to the mother-baby unit. So whether you have a vaginal delivery or a cesarean birth, you'll be here about 2 hours for your recovery period, and then be moved to the mother-baby unit. So this is our tree of life, and one of our very own nurses, Jessica, designed and made this tree, and we changed with the seasons. So obviously right now it's fall. In the winter we're going to have snowflakes, and in the spring I don't know what we're going to have, but we'll have some kind of leaves. So you'll be able to come here after the birth of your baby and pick out a leaf, and we have a pen in here and a pin, and you'll be able to write your baby's first and middle name. If you want to put the birth date, how much they weighed, any of that information that you would like to have on there, just remember it's a public board, so everyone will be able to see it. And then the nurse will take a picture of you in front of the board with your baby. If you would like to provide us with a camera, we'll be happy to do that. So this is just another way to honor birth and recognize it's such a significant event in the lives of all of you.
Hi, I'm Debbie. I'm one of the NICU nurses that you might meet if your baby happens to have to come to the NICU for whatever reason. This is one of our rooms in the unit here at RiverBend, and every baby that gets admitted here has their own room, and if it happens to be twins or triplets that you're having, eventually they will all be in the same room before they go home. This is our warmer bed where babies get initially admitted to. It allows us to be able to provide them with heat while we're having to do whatever baby needs to get them settled in. Baby would be on a monitor that we would watch their heart rate, their respirations. We can watch blood pressure, temperature, a lot of different things through that. And they would be on that for their stay here in the NICU. For the really early babies that might have some breathing issues, they may have more breathing support, different machines that would help them with that. For moms, we have breast pumps in every room if they are planning on providing breast milk for their baby. We have a refrigerator in the room for storing baby's own milk. Some babies, their stay here in the NICU may only be for a matter of a few hours. Some babies may be here for a longer duration depending on gestational age and their need, but we welcome families and the babies and look forward to taking care of them. Thank you.
So here we are in the mother-baby room. We have 36 of these rooms out here. They're all private. You will have a crib that'll be stocked with everything for your baby. We call your pediatrician right after the baby's born, so they will come see the baby every day until you go home from the hospital. And the same thing with mom's doctor or midwife. Somebody from that group will come see mother every day until she goes home. When you come out here, you will get a new nurse that will take care of both mom and baby, and we will give you a discharge checklist of all the things that need to be done before you go home with your baby. We have a DVD player in each of the rooms, and we offer you a DVD to watch while you're still here in the hospital. We have it both in English and in Spanish, and it has a total of about 3 hours of video. We request that you watch at least the first section so that you will have a basic idea of what to expect when you go home from the hospital and care for yourself and for your newborn. You will get a menu. You can pick out what you want to eat for your 3 meals a day, and your nurse that takes care of both you and the baby will check on you frequently throughout the day and be able to bring you pain medicine or anything else that you might need during your stay. We provide dads or support people with linens and pillows and extra blankets so they can lay in the bed. We change this couch into a bed at night so they'll be able to stay with you overnight. You also have a rocking chair and a straight back chair. This bed is an air mattress, so it adjusts as the mom turns and moves, and it's fairly comfortable. Most people really like them. We do have the following morning after the baby's born, the lady from Medical Records will come and she will help you fill out your birth certificate. You're getting an application for the Social Security number for your baby, and if you would like the birth of your baby printed in the newspaper. So she does all the paperwork things. Then we have a picture lady who will also come, and she will offer to take your pictures and usually give you a time. You'll together pick a time that would be convenient for you, and they will take 20 to 30 shots of the baby with mom, with dad, with grandparents, family shots, siblings, whoever you would like. And since they set up a time, you'll be able to have your baby in a special outfit or blanket if you so desire. You will get a code that you'll be able to go in and look at the pictures that you chose. You'll be able to pick your top 8 pictures, and those will be on their website. And you can give out the code to whoever you would like to have access to those. For vaginal delivery, you'll usually stay 1 to 2 nights after the baby's born. And a lot of that depends on how long or difficult your labor and birth were and how well the baby's eating. We also, if you have a cesarean birth, will usually stay an extra night, so usually 3 nights after the baby's born. All the nurses here are trained to help you with breastfeeding, and they will be happy to answer any questions or concerns that you have. We also have lactation consultants that are here every day, even Saturdays, Sundays, and holidays, and they can come answer questions and help you with feedings as well. We do have an outpatient program, so if you go home from the hospital and things are not going well, you can call us. We can answer questions over the phone, or you can come back in and we can help you with the feeding if you make an appointment. Each afternoon we have a rest time that's available from 1:30 to 3 p.m. and we ask that if you'd like to participate in that, just put your sign on the door. All of the visitors are to be respectful of that, and the nurses and staff will not come in your room unless you call them during those times. You also have the option, if you want, is you can turn this over on the back and you can write down whatever time you would prefer for people to come in so that you can control the amount of visitors that you get at other times. And we do have a community room, which I'll be showing you next, where people can wait and maybe trade in and out. Since this room is a little smaller than the labor and delivery room, if you end up with a lot of company, remember that that is available. One of the other things that we do is we do some tests before the baby goes home, and there are basically 4 tests that we do. One's a cardiac screen, one is a test for jaundice, it's a bilirubin. We also do a metabolic screen and a hearing test. So those will be explained to you in more detail. And then the last thing we do before you go home is we'll have you check out at the front desk. And during that time, they will take the security band off the baby, and you do not need to bring your car seat into the hospital, but you want to make sure you have it safe and secure in your car for when you go home. We do have, Kohl's has a monthly car seat safety check that you can attend. If you look on our website, you'll be able to find out when the next available time is. So I wanted to talk to you about your infant feeding choices, whether you breastfeed or bottle feed. We are here to support that choice and to help you with any questions or concerns that you have. All of the nurses have been trained to help you with breastfeeding as well as bottle feeding and have had classes, up-to-date information, so we're giving out a clear, consistent message to our patients and their families. Feel free to call and ask for extra help or support as needed. We do have lactation consultants here in the hospital. They're here every day, and we have a wonderful outpatient program where you can call in, ask questions, get support and help, and you can also make an appointment to come in and have help with a feeding or answer additional questions as needed. Our phone number for the outpatient lactation is 541-222-3922. In conclusion, we are here in the community room, and this is an area that's located right in the center of the mother-baby unit. So if you have additional area that you need to have family and visitors wait, this is a great resource, and you will not need to go back out to the middle of the 5th floor. So in here we have a public use computer and a phone. We have free Wi-Fi throughout the hospital. There's a refrigerator, a hot water spigot. We also have a TV. There's puzzles, games, toys. So it's just a place for people to be able to rest or have a place to hang out while other people are visiting. We want you to know that we encourage you to speak up. Let us know the things that are important for you and what you would like in your birth experience. And our job is to be a patient advocate and go to bat and get that for you. So speak up, and we will do our part in helping you be able to achieve the experience that you would like to have. We know that you remember the day your baby was born when you're 80 years old, and you remember the things that the doctors and nurses said to you. So as much as we can, we want to help make it a great experience. Thank you so much for taking the time to watch this video. We look forward to taking care of you soon and getting you off to a great start at Sacred Heart.